G'day and welcome to the assessment module of our pelvic floor and core restoration program. The purpose of this module is to check whether or not you actually need the 6 steps, to identify weaknesses early, and also establish whether you're high risk, low risk. Do you need to see a pelvic floor physio or women's health physio before you start exercise? So there's a couple of tests you can do on yourself. All of them are done in this position. Okay, the first thing we want to do is ascertain whether or not your abs are doming. So for that, you just do a little crunch, poof, look at your abs. So my abs are pretty flat, that's pretty exciting. But what you're looking for is a sort of a wave-shaped dome right down the middle of your abdominals. Now, if you get that, then that means your linea alba, the band of tissue that joins your 2 abdominal muscles, it means it isn't withstanding pressure from the inside, what we call intra-abdominal pressure. And that puts you at risk for a hernia or, just your organs coming out where they shouldn't do. Obviously, that also means that your integrity through your core is compromised. And if you have doming, it's probably a good idea to go see a physio before starting exercise. If you have no doming like me, the second test is also performed in a little sit-up crunch. You grab 2 fingers and you start at the base of your rib cage and you dig your way down your abdominals, the whole way down. You're feeling for 2 things. One is how easy it is to push your fingers in, and the second is how wide apart the separation is. So if you're only 1 or 2 fingers apart, brilliant. If you can fit a whole 4 fingers right in between your rectus abdominis, your big abdominals, then that's an issue. That would be a reason to go see a physio. The second part, how easy it is to push in. If it's super easy to push in, it will present in doming in the test that we just checked then. The next test we do is for your TVA, or transverse abdominis. And these are tiny little abdominal muscles underneath your big rectus abdominis. So it's important that you're relaxed, not crunching this time when you do this test. So, we're lying down again. This time you're going to breathe in and breathe out for a count of 8 seconds. What you want to see is when you breathe out, your abdominals suppress down like this. If you push out with your abdominals, they come up, then there's an issue there with your coordination and your mind-muscle link with your transverse abdominis. The second thing that we'd like you to feel for is if you put your fingers in your hip bones here, as you breathe out, you want to draw up the pelvic floor and you should be able to feel a very subtle tightening of the muscles under your fingers. So we breathe in and we breathe out, drawing up the pelvic floor. What you don't want to feel is your fingers being pushed out of your hip bones. That means you're again using your big rectus abdominis, and there's an issue there with your coordination of your deep true core muscles. So then I would also recommend going to see a pelvic floor physio. We've got 2 more tests to do. One is posture and one is mobility of the upper back. And these are important because if your posture is bad and your mobility through your thoracic spine, the middle part of your spine is bad, it adds load to the pelvic floor and will possibly encumber your recovery. So, the 3 mobility exercises that I perform with my clients are all based on the middle spine. The first one is a twisting exercise, and it's just for your information. You just want to see if you can twist evenly both sides for a start. And then you'll be able to re-film yourself or do it in the mirror and see if you're getting better as you go. Now I have a 7-month-old and I can feel that I'm a lot stiffer on that side than I am on this side. And so that would be something I would work on. The second test, with your hands behind your head, we're going left to right. Make sure you stay nice and straight with your posture. Cool. And the third test is what I like to call the slump flex. You make yourself a little ball and then palms of your hands go up towards the roof and we bend back as far as we can. As I said, I have a 7-month-old and I am so stiff through here, it's not funny. But I know one day I will get better at this. The posture tests are really just a simple matter of taking a photo of yourself in the mirror and seeing how you stand. The most common issues that we see with postnatal women are the upper and lower cross syndrome, so that specifically is what we're looking for. So when you look in the mirror, do your shoulders slump? That's upper cross syndrome. And does your lower back sway? Lower cross syndrome. From the front, upper body slump, lower body flex. That upper lower cross syndrome is a real issue, especially upper cross pushes down on the pelvic floor, so loads it more, and then lower cross, when your hips tilt forwards, that can disable the effectiveness of your pelvic floor. So for some of you, just working on your posture will be enough to solve any of your pelvic floor lower back issues. Now, if anything came up in those assessments, you need to start at step 1 of our Core Restore course. And probably see, if you're going to do it by yourself, you should probably see a women's health physio at the same time. You can go to our website for more information or to request a referral. The website is IntoYou, just a dash, no lowercase, you.com.au. Hopefully we'll see you there.